Welcome to this episode of CQC Connect. My name's Ed Foster. I'm one of the comms and engagement managers here at CQC. Back in May, we launched our new strategy, and this is the latest episode in a series where we're exploring the ways we're starting to implement our ambitions and transform how we work. In this episode, we'll be talking about our current thinking around our work we're doing to develop our new regulatory model, our assessment framework and approach. We'll also spend some time focusing on our latest thinking on the role that evidence and insight will play in coming to a view of quality. Before we get into it, I just want to hand over to my guests to introduce themselves. Dave, over to you first.
Hi, I'm Dave James. I'm Head of Adult Social Care Policy at CQC.
And Amanda.
Hello, I'm Amanda Hutchinson and I'm the Head of Policy for Regulatory Change at CQC, and I'm leading our work on developing our new methodology.
So, Amanda, just to come to you first, can you start by setting the scene, just updating us where we are on some of this work, developing our new regulatory model and some of our ambitions around it?
Yeah, sure. So what we've done so far is we've taken a look across our strategy and across the kind of four themes sit within that, and also brought together feedback that we've had on how we want to improve the regulatory model and approach that we have now, things that we've identified that we need to improve as CQC. What we've also done is we've already consulted on some of the broader changes that we want to make. So, for example, moving away from set inspection frequencies and also being able to update ratings without inspection. What we're doing now is to work up the detail of what this means in practice for our regulatory model. So that's about how we register, assess, rate, enforce, and our independent voice functions. So looking across all of those functions and also thinking through, well, what are some of the high-level things that we want to improve about how we do things, but also then starting to think through the detail of what this means in practice for how we assess providers going forward. So some of the things that we're looking at is obviously making sure that our ratings reflect the current view of quality in a provider, and that's one of the things that we kind of need to achieve through our approach going forward. We also, importantly, want to in future adopt a kind of single view of quality that works across all of our functions. And I think Dave is going to talk a bit about our work on our assessment framework and how we're developing the thinking about that. But it's about how we make sure that whether we are registering, whether we are assessing a provider, or whether we are assessing a local authority or potentially an integrated care system, there's a kind of overall unified view of what good quality care looks like from a CQC perspective, and also importantly from the perspective of people using services. We're looking at how we're going to bring together our registration and ongoing assessment processes in a more seamless way, and also, as we said, importantly, how we put people's experiences at the centre of our judgments going forward. So lots of work, lots of development work and thinking going on across all of those areas of CQC's work, and then also really starting to get into some of the detail around what an assessment process that delivers that up-to-date view of quality actually looks like in practice, and how we deliver that in a way that improves the experiences of people who are using services, but also providers as well.
Thanks, Amanda. You're doing my segues for me there. I think there's a nice link into the assessment framework and process. So, Dave, just come over to you. I know people have heard a couple of months ago we did a podcast zeroing in on our assessment framework. It'd be really great to hear about where we're at with that work and a bit of a précis for people.
Sure, yeah, and Amanda's touched on it there as well. So we are looking at developing one framework across everything that we do, whether that be registering providers, our ongoing quality assessments, our future role in local authority, and as Amanda said, potentially the kind of system level assessments and assurance that we will be delivering as part of our future regulatory approach. We're essentially in the process of testing our thinking. Do people think this looks like a sensible structure? Because a lot of this is actually about how do we structure something which is sensible and which lends itself to that very broad range of activities and that huge difference of in terms of the different service models and the different scales that we're looking to apply this. Does the structure that we've come up with make sense? And just to recap on that, for people that might not have heard previous podcasts, we are looking at having much clearer and shorter descriptions of quality pitched at the level of good under each of our 5 key questions. And at the moment, that's looking like there are between 6 and 10 statements, which are in the form of effectively a commitment. So we do this, we do that. It's that language, and it's very much plain English. Sitting underneath those, we have what we're calling evidence categories, but which some people might appreciate thinking of in terms of what we used to term our key lines of inquiry. They're essentially the questions and the ways into us understanding if those commitments, those expectations are being met. And so we're currently talking to our partners and our stakeholders and trying to understand how they feel about what we've got to, getting their views. Today is part of that, as well as conversation we're having with you. But also at a more detailed level, are we covering the right topics? Our starting point was essentially building on our frameworks that we already had in place and transposing that into this new simplified structure. So that meant where we'd set the bar and the topics all went with that as well. So big question here is that still right? Are those still the right topic? If you're looking across a system, if you're interested to see how well providers work in partnership, are we clearly enough drawing that out, or is there something more to do in terms of the language? So the structure and the scope of the framework is something that we are actively asking people about and getting their views on. We're also doing some work internally at the moment just to start to test out this idea of how we might use scoring more. Part of the structured approach, how we might be able to generate scores at levels that make sense to allow us to be smarter, as we've talked about in our strategy. So that's broadly where we are in the assessment framework.
Thanks, Dave. That's great. I mean, CQC has a really strong track record of engagement. You've talked about, we've already had quite a lot of those conversations already, and we're very much in like that listening mode now. What are the sorts of things that we've been hearing from providers? You know, are they fans? Are we getting them a green light from them?
Yeah, it is going well. I'm certainly not trying to blow our trumpet here, but in some ways I'm not surprised, because our starting point for this was looking at everything we have heard from providers across all of our sectors over years, you know, and actually learning from the issues that we know, areas that we know we want to improve, but also just some of the problems that providers have come to us with, and just trying to sort of take a step back from that and take a holistic view as to, okay, well, what would a new model need to do? What would a new framework need to do as part of that to start to address some of these? And it's great to hear that we seem to be getting that right. We're getting really positive responses. I think we're probably at the point now where a lot of our stakeholders are ready for the next level of detail. And I think that's right. And that's kind of, okay, at a high level, we can see this works. We've got confidence that we're not losing anything here, but how actually will it work in terms of, you know, a small learning disability residential service versus an NHS trust? What is it at that next level of detail in terms of the evidence that we'll look at, and how will that actually work? And that's kind of where we're coming to now, is starting to build up that detail and get thoughts on that. But yeah, it's good support from providers for where we've got to so far.
Great. It's really encouraging to hear. So Amanda, just to focus in on the role that evidence might play in this new model. So we know that having the right evidence is vital for making good regulatory decisions. Could you introduce some of our thinking in this area? I know Dave touched briefly on the scoring there, but you know, it'd be really good to have a bit of an overview on the role that evidence and insight might play for us in the future.
Yeah, sure. So I think, as Dave said, we're kind of looking at very carefully at how we structure our assessment framework and assessment approach in future. And I think we're clear that we're holding on to the 5 key questions. They've served us well. We're also building underneath those that set of quality statements that are our view of what good quality care looks like, linking up with what we know people who use services look for in a service. But at the level underneath that quality statement, what we're going to be much clearer about is the evidence that we will look for in different services in order to make our judgments. And I think, as Dave said, we've been able to kind of look across all of the prompts that we have in our current regulatory model and distill those down into basically 6 evidence categories. So looking across the quality statements, we'll be looking for evidence that we can categorise as either evidence about people's experiences of care, feedback from staff and leaders, feedback from partners, observation of care, and that's really important. That's about how we are continuing to go out, inspect, observe care, talk to people, processes, and also outcomes of care. So those 6 evidence categories, and then against those, identifying for individual types of service what we think the key pieces of evidence are that will enable us to make a judgment as to whether a service is good or outstanding or requires improvement, etc. And by being able to specify that evidence, that also gets us to a place where we can be much more transparent and much more transparent about how we're making judgments and how we're structuring the judgments that we make. It also allows us to introduce scoring against that evidence and those evidence categories. So really being able to kind of work through a process of, yes, here's the information that we've got about people's experience in this particular service. And that's telling me that that service is probably equating to a good rating and giving that a score. And then in turn, that then will enable us to introduce a kind of further level of detail to our ratings. So that's the thinking that we're doing at the moment around how we use evidence. And as Dave said, I think the feedback that we've had so far has been that this feels like a kind of really useful direction of travel, certainly from a provider perspective, because it does give that clarity and transparency around what we're looking for.
Yeah, it sounds like it'll really meet that challenge that we've had from providers over the last 5-7 years, doesn't it? Am I right in thinking we'll be looking to collect evidence on an ongoing basis?
I think we kind of need to think through whether that's the right word or not, because I think there's a kind of sense in this. This is about a view of quality that's up to date. In order to keep that view of quality up to date, we need up to date information. But there are kind of many sources and ways in which we might get that information. As we've said, some of it is information that we'll kind of gather. Some of it is information that we'll get through talking to people. But also some of it is information that we will get from external sources. And I think this gets us to a place where, as kind of rather than us having a process whereby somebody is coming up for an inspection, so we go out and ask for lots of information, this is much more about flow of different types of information that we can be bringing together at different periods in time to update our view on a rating.
Thank you. So now we just want to move on to looking at some of the things that we've produced following our assessments. At the moment, obviously, we go out carrying out an inspection, produce an inspection report, and alongside that, a rating or a judgment of quality. Dave, I wonder if you could introduce what we're starting to look at in this area.
Sure. I mean, it follows on from what Amanda was saying about how we want to break down our ratings to show more transparency, really, and show how we've arrived at our judgments. And so I think that's the first thing, is how can we best share that? What's useful to all the range of people and their individual needs, whether that's the public looking to choose a service, or whether it's the provider. What do those different customers of ours actually need to see? One thing we've heard, you asked earlier, Ed, about how providers are feeling, and one thing we heard recently at one of our events was providers are keen that we don't lose that story that we're able to tell, and particularly where there is something perhaps unique happening, which of course, every service really is unique. So we need to be able to balance improving our consistency and our transparency, but at the same time, we don't want to lose the richness of what we can tell with narrative. We're really kind of at the start of that process now, is starting to look at and to seek views on what would be useful in terms of the reporting that we're doing, what we put out there, and how that might differ for different groups, and what's the right balance between that textual kind of report and more structured scoring. And I think there's some questions there about and how often do you update that, given we've got this ambition to have an always-on view of quality. What does that then mean for how often we publish that? And there's lots of questions, I think, that will be coming to people for views on.
Thanks, Dave. Final question for everyone. What would success look like for this work?
Shall I kick off on that, Ed? So I think for me it is that we achieve this up-to-date view of quality for the public and people using services. And then I think success would also be that we've kind of delivered this more consistent and transparent approach across our regulation.
Dave, any final reflections?
Definitely echo that. The other thing here for me would be that what we do makes sense to everybody, and that we actually do have that single shared view of quality across health and social care in a way that genuinely meets the public's expectations and needs, but also means that organisations like CQC and other oversight agencies and improvement agencies are all kind of pulling in the same direction and can all sign up effectively, I think, to what it is that we're trying to achieve here.
Great. I'm sure that last bit in particular will be music to providers' ears. So, I mean, it's great. We covered a lot of ground there, and then there's loads of great stuff and lots of stuff for people to look forward to. If people would like to get involved in helping shape this work on an ongoing basis, and they can go on our digital engagement platform, Citizen Lab. We'll pop the link in the description. You can also catch more on how we're implementing our strategy. We'll run blogs and things like that on our Medium page, and also keep an eye on our YouTube channel as well. Just final thing from me is just to say thanks to my brilliant guests, Dave and Amanda. Thanks for sharing your thoughts on our latest work today, and I'm sure we'll catch you again down the line. Thanks very much.
Thanks, Ed.
Thanks,
Bye.
Ed. Bye.